you were having a question. It's Bob Ficano, who's the county executive of the county that we're in.
Yeah, thank you very much, Governor. And Governor Doyle, we appreciate you having this forum that's here. Wayne County is the largest county here in the state of Michigan. We have approximately 2 million people. We know well over 350,000 of them have no insurance, and I think there's probably 1.5 million that have no insurance here in the state of Michigan. But I can tell you what, they do have insurance in one form that's probably the most expensive. If something happens and they're sick, they go into the emergency room, which is the most expensive way that you can handle this. It's human nature. If you're a mother and you have a sick child, you're not going to let the child just be sick and do nothing. You're going to go into the emergency room. So I think part of what we have to do is realize we change the paradigm. It is costing everybody, because when they go into that emergency room, those costs are going to be shared, whether it's through Blue Cross or someplace that eventually all the premiums go up to cover that. So we are paying right now, so how can we be the most efficient? One of the other things that I think is critically important are electronic medical records. And to set it up so that not only that there's incentives, but perhaps there's penalties as well to move everybody into the system. I know it saves money in terms of, not that all doctors have bad handwriting and things like that, but the records that it's able to do, but also to coordinate, because somebody who might walk into an emergency room, we have great medical facilities here in Wayne County. We have 4 great institutions. But if one walks into one room, emergency room one night, a week later walks in to a different institution, they'll go through the same type of tests and everything else because the systems don't talk to each other. So electronic medical records with incentives or penalties, I think that would be critical.
Great.
Thank you.
Great.